10 steps and tips for intravenous cannulation. Here we go.
Gather equipment. Collect the equipment required for the procedure and place it within reach on a tray or trolley, ensuring that all the items are clearly visible. Wash your hands using alcohol gel. If your hands are visibly soiled, wash them with soap and water. Interview. Introduce yourself to the patient, including your name and role. Confirm the patient's name and date of birth. Explain what the procedure will involve using patient-friendly language. Gain consent to proceed with intravenous cannulation. Check if the patient has any pain before continuing with the clinical procedure or any allergy, especially latex allergy. Choosing a vein. Decide which arm you plan to cannulate. Position the patient's arm in a comfortable extended position that provides adequate access to the planned cannulation site. Inspect the patient's arm for an appropriate cannulation site. Apply the tourniquet approximately 4 to 5 finger widths above the planned cannulation site. Palpate the vein you have identified to assess if it is suitable. Prepare the cannula, open wings, slightly withdraw/replace the needle, unscrew the cap. To make the vein more obvious, anchor the vein with your non-dominant hand from below by gently pulling on the skin distal to the insertion site. Clean and rub the site with an alcohol swab for 30 seconds and then allow to dry completely for 30 seconds. Ask the patient to clench and extend his hand. Inserting the cannula. Warn the patient that they will experience a sharp scratch. Insert the cannula directly above the vein, through the skin at an angle of 10 to 30 degrees with the bevel facing upwards. Observe for a flashback of blood into the cannula chamber. To increase attempt success, consider bending the needle catheter system. Lower the cannula and then advance the needle a further 2 mm after flashback is observed to ensure it's within the vein's lumen. Partially withdraw the introducer needle, ensuring the needle end is within the plastic tubing of the cannula. Release the tourniquet. Apply pressure to the proximal vein close to the tip of the cannula to reduce bleeding. Gently pull the introducer needle backwards whilst holding the cannula in position until it is completely removed.
Connect a luer lock cap or primed extension set to the cannula hub. Dispose of the introducer needle immediately into a sharps container. Apply adhesive strips to secure the cannula wings to the skin. Do not obscure the insertion site with the strips, as this needs to remain visible to allow early identification of phlebitis. Inject the normal saline into the cannula using the flush you prepared earlier.
Thank the patient for their time. Document the details of the procedure on a cannulation chart or in the patient's notes.